Hey guys, Brock here from Command, and today we're going to be talking about an advanced lipid panel, which gives us a lot more information than a basic lipid panel. Most people, when they get annual labs done, just get a basic lipid panel, and that's just going to show some kind of broad strokes cholesterol health markers. But an advanced lipid panel is a lot better, it gives us a lot more detail. So to start off with, the overall narrative of plaque formation in the coronary arteries is some sort of trauma to the blood vessels, causing cracks and crevices in the heart arteries that then allow cholesterol, specifically small particle cholesterol, to squeeze into those gaps, which become plaques over time. The first marker that we get with an advanced lipid panel is an Lp-PLA2 activity marker. This is inflammation that is specific to the coronary arteries. That trauma through inflammation is, again, what causes plaque to form up in the presence of bad cholesterol or small particle cholesterol. What we want to do is try to avoid things like chronic stress, which causes inflammation, as well as smoking, high blood sugar, and pro-inflammatory foods like excess sugar, refined carbs, seed oils like canola oil and palm oil and sunflower oil, those sorts of things. And we also want to avoid ultra-processed foods. All of these things are pro-inflammatory. Another way to look at it is we want to manage our stress well. We want to eat a whole foods diet while avoiding seed oils and eating, extra virgin olive oil and butter and that sort of thing instead. And we want to avoid smoking and alcohol and diabetes. Some of the things we have to lower Lp-PLA2 activity, in addition to those holistic things that I mentioned, statins tend to lower Lp-PLA2 activity, fibrates, which is another prescription cholesterol medication, and even niacin, which is vitamin B3, and just a supplement, can also help reduce the inflammation in the coronary arteries. The second marker we look at is lipoprotein(a). This is another risk factor for cardiovascular disease. It has a strong genetic component to it, and while there's no clear way to lower your lipoprotein(a), the primary goal in the setting of elevated Lp(a) or lipoprotein(a) is to minimize the other risk factors for cardiovascular disease. So if you have diabetes or prediabetes, getting your blood sugars down to a good level, improving your diet, improving exercise, that sort of thing. The third marker is ApoB, or apolipoprotein B. This is a protein carrier that's attached to LDL and VLDL, which are, again, the kind of cholesterol that can cause plaque formation. And because ApoB proteins are attached to these atherogenic cholesterol particles, a high ApoB level suggests high amounts of plaque-forming cholesterol particles in your blood, so it is a significant risk factor for cardiovascular disease. The fourth marker is small particle LDL. Again, this is the tinder in the fire plus tinder narrative that causes plaque formation. Not all LDL cholesterol is created equal. For instance, large fluffy LDL particles are very healthy for you, so there is a limitation to only knowing the total LDL number from a basic lipid panel, because we don't know how many of those total LDL particles are large and healthy versus small and plaquogenic. The advanced lipid panel measures how many small particle LDL that you have, as well as the particle size and pattern, which tells us on average whether your LDL tends to be large and healthy particles or small and unhealthy. As far as reducing these cardiovascular risk markers, one method of decreasing small particle LDL and increasing healthy large particle LDL is to take an omega-3 fatty acid supplement. Omega-3s are typically found in fish, but in the typical American diet, we simply don't get enough omega-3s. So taking an omega-3 supplement, such as OrthoMega from orthomolecular products, generally around 1 to 4 grams a day, depending on how high your cholesterol markers are, can be a safe and holistic way to improve your cardiovascular disease risk. Depending on which markers are elevated that we just talked about will depend on the strategy. However, the common theme kind of amongst all of them is that a healthy, mostly whole foods diet, keeping alcohol in moderation, and getting regular exercise is very important across the board. Statins, fibrates, PCSK9 inhibitors, and other prescription medications we'll sometimes use to lower cardiovascular risk and improve these cholesterol markers. From a supplement standpoint, we often use things like niacin, which is vitamin B3, omega-3 fatty acids, like I mentioned before, bergamot, and berberine. These are just some of the supplements that you can use to holistically target improvements. It's important to make sure to discuss your individual cardiovascular risk with your command provider and ask them whether you might benefit from getting an advanced lipid panel. The current pricing for an advanced lipid panel is right around $80 at this time through LabCorp if your command provider orders it for you so that you get that wholesale cost. Now, as far as featured services for our December 2024 newsletter, we recently sent out a survey, a patient survey at Command, and we'll likely be discussing some of the frequently asked questions in a future email to our patients, but I wanted to highlight just a few right now. The first thing is having an emphasis on holistic medicine. Some patients wanted holistic education and help from their command provider. These are things that your command provider should be able to help you out with, things like weight loss, cholesterol health, vitamins, supplements, mental health. Make sure to bring up any general or specific questions you have to your command provider so that they can point you in the right direction with those. Some people asked about video calls. They would like that feature. Actually, all of our command providers have the ability to do video appointments with patients. It can come in handy when you can't physically come to the clinic, or maybe your kid is sick with a respiratory bug and they're kind of working to breathe, and that's an easy way to kind of see how they're doing a little bit better. So make sure to ask your command provider about a video call if you think that you might benefit from that. And then just the third one I wanted to mention real quick is x-rays and orthopedic injuries. We are able to do x-rays in-house, and the current price for that is $50 for our members. As far as splinting, we are able to do basic splinting in the clinic. For more concerning fractures, we may refer out to an orthopedic clinic for that. So just make sure you talk to your command provider if you have an orthopedic injury that might need to be assessed. Guys, that's it for our December newsletter. Stay tuned for our January newsletter. And as always, reach out to your command provider if you have any questions, and especially if you would benefit from any of the services that I just discussed, as well as the advanced lipid panel.